Hi, everybody. Welcome to this Prevention Institute webinar. I'm Vanita Tsao, and I'm joined by my colleague, Rachel Davis. We're here in Oakland, California, and thanks to the wonders of webinar technology, we're able to connect to you guys in Salinas. I'm not sure how many of you are familiar with video games, but the title of this webinar is really about gaining experience and new skills and sort of developing a sort of new sophistication to what you're able to do. In a lot of role-playing video games, you develop a character and you sort of control that character and explore this video game world through that character. And as you gain experience, you level up. And what leveling up means is you gain new skills, you get better tools, and you're just a stronger character who can succeed in the video game world. And what Rachel and I are going to try to do today is share with you some frameworks for talking about preventing violence and talking about the need for community-level strategies. And hopefully, that information will help you level up in terms of task work and preventing violence. So not just working with families and individuals in crisis, but looking broader than that at the neighborhood level and looking at primary prevention and not just intervention or responding after the fact. So the focus of this webinar is really on the community level and why it's so important to look at neighborhood strategies. And Rachel and I are going to go through some frameworks and make the case for community-wide approaches that hopefully you can adopt and is useful to you in your work. We're hoping that this event will be really interactive. You'll notice that there's a text chat and there's webinar technology, and we're hoping for lots of input from you since you guys are the experts on the ground. Feel free to use the text chat to ask questions throughout the webinar, and we'll be keeping track of that, and we'll try to answer as many as we can at the end of the webinar, I think at 11:15 or so, right? So I'm going to hand it off to my colleague Perla, who will talk us through the webinar technology and all of its capabilities.
Hello everyone, I'm Perla, and I just wanted to take a few minutes to go over some of the technical assistance that's available today on our webinar. If you could all just take a look at the iLeak web conference, it allows us to have a more interactive presentation where we can really engage with you all via the text chat that Benita had mentioned. If everyone can look at the top left area of the screen, you'll find a hand icon. It's circled in red, and this function allows participants to raise their hand during the webinar. And you'll notice that right now everyone is currently muted. And if you all have a question, if any of you have a question during the webinar, feel free to click that icon and we'll reply to you via private text chat on the right, and we can make sure to answer your question or save it to the end. When we get to the question and answer section of the presentation, participants can raise their hand, and we will also, I think, be keeping a list of all questions and organize them at the very end and answer the most relevant questions and hopefully get through all of them. If you look at the bottom left portion of your screen, you'll see a chat area. This area will allow participants to chat either publicly or privately. Currently, we have 10 people on the webinar today. And if you'd like to have a private chat, just click the private chat tab, and you can select a specific participant to reply to by double-clicking their name in the private chat box. And actually, I'd like to test the private chat or the public chat box right now. If you all could please share your name, your organization, and if you're familiar with the concept of leveling up. So we'll just actually wait a few minutes and see if you can all use that feature.
Anybody? Oh, there's Rebecca. Hi, Rebecca. She's calling in from Portland, Multnomah County, and I think is another Strive site along with Monterey County, right? So welcome, Rebecca. Anybody else? Oh, wow, 14 people with Linda. So Linda's got like her own little party going on at the health department. That's wonderful. Vin's caller, hi. It's also in Oakland. So someone probably just down the street from us. Anybody else? And Ariana Green, hello. We'll be talking a bit about transportation, too. All right, so it looks like most of you have mastered the public chat. Pearl, are there other skills they should try now before we get started?
No, that is good for now. And actually, there's If you have any problems throughout this webinar, call the iLink number that's shown on the screen, or call the Prevention Institute line, and then we'll direct you to iLink. Okay, and we'll just go ahead and start.
All right. Hi, everyone. This is Rachel Davis. Welcome. I want to start with this quote I actually found in the New York Times several years back. And what this says is, we have found an environment that is potentially suitable for living organisms. Now, this was from Carolyn Porco of the Space Science Institute, and she was talking about a moon on Saturn. But it got me thinking about the environments that young people are living in today, and wondering, is this a suitable environment? So I want to take that notion and play do a little bit of an interactive activity with you, and hopefully, Linda, you'll be able to represent 14 folks' input through the text chat. But we want to just get right into sort of talking about the community environment and what does violence or what does safety have to do with it. So let's start with this picture. And when you see this picture, what do you think about how that might contribute to maybe a lack of safety in a community? We'll stay on this one for a second. And just, if anything comes to mind. Please use the text chat to share your comments. I mean, the first thing that comes to my mind is, you know, if kids don't have safe places to play, maybe this is where they end up hanging out, is outside the liquor store and, you know, with cars in the street and cigarette ads. Yeah. I think one of the most prevalent things that comes to mind for me is sort of the targeted marketing of high-content alcohol. And, of course, we know there's a relationship between alcohol availability and violence. Why don't we go on to the next slide? Okay, what about this one? This is actually not a prison. This is a housing project. What do you think about that in terms of the notion of how that might relate to safety or a lack of safety in a community? And maybe while folks are typing stuff in, Benita, you have thoughts about that? Yeah, that's the first thing that came to mind for me was, oh, it's this it's housing that looks like jail, and you know there are no people in this lot, which I'm not sure is a parking lot or a playground. Like I'm not sure what it's supposed to be, and why neighbors aren't in that space if it's supposed to be designed for them. Yeah, somebody wrote in complete lack of green space. And we know from studies that have been done on housing development projects that there is really a correlation between green space and mental health and well-being and lack of depression. And yes, this could remind people of being incarcerated. It's not clear to me if the bars are to keep people in or keep people out, but really, institutionalized, isolating. Let's go on to the next one. If folks want to keep typing on that one, great. How about this one? Verla es quererla. To see her is to want her, I think is one way to translate this and to think about it. What comes to mind for folks in terms of safety issues here? I mean, I think it ties back to that first photo, too, in terms of advertising and who the clients are and whether these are healthy products or not. But I think it reminds me of sort of turning the woman into the object. Like it's kind of hard to distinguish her from the bottle, and what does that say about empathy and violence against women? Yeah. Yeah, we also know that there really is that often alcohol is marketing is sort of correlated or tied with sort of objectification of women, and that it's okay to objectify women. It also sets up kind of an entitlement
notion in a way that, when you drink, you get the beautiful girl kind of thing. And when you combine that with alcohol, which is an inhibitor, that can, be really problematic combination. So this is actually going back to Benita's first comments about video games. This is actually from Grand Theft Auto and from a sort of military training video-ish game. So, really gets into sort of the notion of video games, and which is something we know young people are doing a lot of. So thoughts about how that environment relates to safety or a lack of safety? Okay, well,
neighborhood under occupation.
Wow.
Under occupation?
Yeah, that's really a very strong, powerful statement. I think that, we hear some controversy about, video games and do they have an impact or not. But, we looked at a meta-analysis that looked at the relationship between video game violence and aggression. And there really seem to be 5 different sort of consistent results of playing games with violent content, which is that 1, they can increase aggressive behavior, 2, they can increase aggressive cognition, 3, increase aggressive emotions, 4, increase physiological arousal, and 5 could decrease prosocial behavior. So, some of the comment that just came in around this is really depicting, people of color as the aggressors too. So there's a sort of a norming thing going on there. What about this? So this is actually from a San Francisco Chronicle article about East Oakland, which is very close to where we are. And what this says is life in the killing zone. Violence is the most pervasive part of growing up in East Oakland. So what are the implications of that for young people when the most pervasive part of growing up involves violence? Thoughts about that?
Yeah, is this a suitable environment for young people, or even adults for that matter, for people in general, for human life?
Yeah. Well, and then what are the options beyond violence, and knowing and understanding that violence is a learned behavior. Again, this gets to the community environment. So sort of taking all these things together, the notion that at the community or neighborhood level, this is the notion that my neighborhood is killing me, is that this is really a place where we've got to focus as one important part of addressing violence. And I think, what's important to understand about this is that typically when people think about the environment, they think more about exposures like, air pollution or, soil and water. But what we know is that the environment really has a fundamental impact either directly on health and safety, and also that it fundamentally shapes behavior. When the Institute of Medicine studied behavior change, and how do you get individuals to change behaviors, and it's reasonable to think of violence as a behavior, what they concluded from a very massive literature review and meta-analysis is that it's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. So that really means a focus on the social, cultural, and physical environment is going to be critical in terms of prevention, and the community level is really one important place to do that. And prevention really provides an opportunity and a systematic process to look at that level to reduce the frequency or severity of illness or injury. And primary prevention, which really comes out of public health, is the notion of promoting healthy environments and behaviors to prevent problems before they occur, before the onset of symptoms. And so what we want to talk about is a way to think about how to apply prevention at that community environment level. And we're going to do this through a model that we at Prevention Institute call Take 2 Steps to Prevention. So moving out of sort of the violence realm right now, we'll talk about unintentional injury and car crashes. So here, we have a car crash. And, then where we typically go, and not surprising, and because it's needed after something like that, is medical care and medical treatment. But if we were to take a step towards what contributed to that in the first place, we can look at availability, or we can look at the behavior of drinking. And of course, we know there's high correlations between drinking and car crashes, that it's a big risk factor for injury. But if we take another step back to the environment and say what's going on beyond, that first slide I showed where there was, the sort of marketing of high alcohol content, we can see just availability of alcohol everywhere as sort of, with sort of highlighted by the idea of a drive-in window to get alcohol. And so clearly we can think of the environment as having a big impact, which means it's also a really important arena for prevention. And so, we want to think about sort of this 2 steps to think about, let's get to the environment and change the environment so that we can have more effective prevention. And I think, that's very important because, what we know from studying public health and epidemics is that no epidemic has ever been resolved by paying attention to the treatment of the affected individual. And I think that's an important thing to think about because it's really saying, I think, 2 things in my mind. One is we're not going to get there by focusing on treatment alone after the fact. And of course, after the fact, we do have to focus on treatment, but we've got to focus on steps before. And we're also not going to deal with the epidemic of it just by attention to the affected individual. And I think that's the place where, we know from what works in public health that we've got to get to the population. And I think we can do that through through looking at the community level. So what I want to do, now we're going to talk about a public health model for addressing violence, and I'm going to turn it over to Benita to take us through that.
Yeah, I think that quote by George Albee, to me it really speaks to sort of how once it's an epidemic, it's beyond the individual already. It's really spread through a population to the point where you can't just kind of treat it one person at a time anymore, and it really requires kind of a broader strategy. I think more and more I've noticed in mainstream media that violence is being talked about as an epidemic, not just something that can contribute to chronic disease or create stress, but something that can spread through a population. And it's really encouraging to see it framed as a public health problem because it means that the solution has to include public health as well. So the 4 components of a public health approach to violence are described on the slide there. My cousin is an ER doctor, and how I like to talk about the difference between medical treatment and public health is that, my cousin really sees people who have survived assault, and she really sews them up and tries to promote their healing and recovery one person at a time. Whereas in public health, we really look at prevention. Kind of before that person even walks through those hospital doors, what are things we can do to prevent them from getting hurt or injured or killed before their time? And we also look at population effects. So my cousin works one person at a time. She sees patients. What public health really does is we look at, what can we do at the population level for the whole community so that her caseload, my cousin's caseload, is as small as it can possibly be. So it's really focusing on prevention and looking at that community-wide lens. The public health approach also reduces risk factors and increases protective factors. So risk factors are things at the individual, at the family, at the societal or community level that makes violence more likely. Whereas protective factors make violence less likely, or even kind of buffer the effects of the risk factors. So let's say you witness a violent event and it troubles you. If you have a protective factor such as someone who you can talk with and process that experience with so that you kind of bounce back from that experience, that's an example of a protective factor that makes violence less likely and also sort of buffers you from the negative effects of violence. So in this webinar, we're really going to focus on community level risk and protective factors. We're going to kind of put the individual and family factors sort of, we're going to table those for the time being. And we're going to go through each of these 4 characteristics of the public health approach one at a time. Historically, I think we've addressed violence through criminal justice more than anything else. We've really defaulted to law enforcement and the courts to address violence. But more and more police chiefs and city leaders are saying we can't arrest our way out of this problem. We can't just lock up huge groups of people and expect that we're going to have a thriving, healthy society at the end of the road. And they've been saying prevention is really key to a long-term solution. And it's been great to see public health become more involved and embrace this as their issue and bring their expertise on prevention. Public health is really has the tools and the experience to really prevent issues and health problems before they come up, and they can apply this to violence just the same as they have to other issues. Justice is certainly critical to addressing violence as first responders and as people to say that they can't do this alone, that it takes public health and many other community partners and city sectors. And it's important to remember that public health really complements criminal justice, that they really bring that education and behavior modification piece to those 3 intervention levels on the slide, that it's not a choice between criminal justice or public health. It's really both of those sectors and so many others kind of contributing to the solution. So we know that prevention works. These are just a few of the success stories that have been made possible because of public health, and they really represent all the millions of lives that have been saved because of child restraint and safety belts, because of minimum drinking age laws, childhood vaccinations, getting the lead out of gasoline and paint in houses and in the air. These are all things that have really saved thousands and millions of lives, I would wager, and I don't see why public health can't do the same for violence too. Excuse me. So if you look at this slide with all the children in safety seats, this is just one example of a public health success story. And I'd like you to click on the hand if you, and as a child, sat in these safety seats when your parents were driving you around town running errands. Hopefully Linda can kind of poll the room and say how many people are raising their hands in the chat. And the reason why I asked this question is because back in the 1960s, we really already knew that these child safety seats really saved lives. They meant that when there was a collision, kids were far less likely to be seriously injured or killed in a car crash. And yet it took decades for kind of norms to change and for public health to get involved with transportation and other sectors to pass laws and start changing systems to really see a big reduction in traffic-related injury. So right now I've got 1 out of 17 with their hand raised.
Like you're doing an diagnostic.
And Linda says 0 out of 16, right? Sometimes I give trainings and I ask this question. I am the only person in the room with my hand raised. Oh, it looks like we've got 4 out of 17. That's great. I've got a little company. But the reason why I do this exercise is just to demonstrate how quickly things can change, and that change is even possible. A lot of times people think of the issue of violence and they think it's really a huge challenge that is impossible to sort of crack. And when I talk about child safety seats, it's like that's what people thought, in the 1960s, that this was an impossible challenge, and they didn't see that they could make a change. But I think the 4 people who raised their hands and me, we're all sort of evidence that change is possible and that it can happen as quickly as in just 1 generation. So this is another clipping that Rachel found. She seems to have a real knack for finding clippings that relate to our work. But this was from the siege of Sarajevo during the Bosnian War in the 1990s. And it's really children who kind of were let outside to play for the first time in 4 years. And when they were outside, they didn't play hopscotch or tag or jump rope. They played war because it was what they knew. And I think when you think about it, kids in Oakland and Salinas, they're really not so different from kids in Sarajevo in the sense that, they are not born violent, but they learn violence because of what's around them and in their environment. The thing about violence, though, is that even though it is learned, it can also be unlearned, and it can be prevented entirely. And I think that when environments and societies and communities are able to provide young people with identity and connection and opportunities and hope, that's really how we're going to turn the tide in terms of preventing violence. And Rachel's going to talk a bit more about how to do this at the population level.
Okay, thanks, Benita. So the social ecological model, I think, it's a model CDC uses, the World Health Organization uses, and I think it's a model for understanding why you've got to focus on multiple levels. I think, traditionally people have been more comfortable focusing at the individual level around like individual skill building and, education, and even maybe at the relationship level around those kinds of strategies. But what the social ecological model says is the individual is incredibly important, but that all these other levels, relationship, community, and societal levels are spheres of influence that have a fundamental impact on the individual. And so to be most effective, we've got to focus beyond just the individual level. And, community is one important sphere for that. And so let's talk about, we've gone through sort of a number of different ways to think about why focus on the community level now. And I just want to give you a couple minutes to text chat in the arguments you would use either based on that information or that you use to make the case to focus at the community level to prevent violence. So how do you make the case for community level prevention?
I'm imagining that Linda's fingers are flying at the keyboard as everyone in the room at the health department is weighing in on this. I can't think of anything else to account for your silence. Looks like Vince and Linda have responded.
Everyone has a stake. Everyone needs to be part of it. And I think that's really, that's a really important point, is that this is really an issue that affects the whole community. And it's something we all have a stake in. The individual focus and enforcement alone hasn't worked. And this next one is so important, that the community knows their community. And that's, of course, really a critical part of the solution. So why don't we let folks, if you want to continue to write in how you make the case to focus on the community level. And what we'll do with that is we will move into a focus on community level risk and resilience factors, which are really the key issues to address for an effective community level approach.
Right, so reducing risk factors, again, those are things that make violence more likely. And it's important to emphasize that even though we're going to introduce a whole bevy of different risk factors, it's not any single one of those that is going to determine whether a violent incident takes place. It's really kind of a mix of, the mix of risk factors at play And then also, what are the resilience factors that are sort of offsetting that? And kind of when you mix that all together in a big pot, like what comes out of that is what determines whether violence actually happens or not. So to look at this list of community level risk factors, you'll see that some of them are highlighted in yellow. And the ones that are in yellow are the community level factors that were prioritized by folks in Salinas through the STRIVE assessment. This is not a comprehensive list of risk factors. I think if you actually dig into the literature and the research, there are hundreds and probably thousands of different risk factors, but these are the ones that we're focusing on at the community level and the ones that are important to you guys in Salinas. I want you to take a look at the ones in yellow especially and think about what this looks like in Salinas. What have you seen in your neighborhoods? What worries you about kind of the youth that you interact with and know? Because after we talk about each one of these risk factors, we're going to open up the chat box for you to weigh in on why you think this rose to the top in terms of the prioritization process for STRIVE. Does the information we share make you think of experiences or stories that you've heard or that you've been through? And kind of what are the implications of this? So take a look, mull it over, and we're going to go to the ones in yellow one at a time.
Yeah, and looking at it too, it looks like poverty should be in yellow as well. So we'll talk about that one a little bit more too. Great.
All right, so the first one we're going to talk about is alcohol and other drugs. And there's been a lot of research done on the connection between alcohol, drugs, and the likelihood of violence. 2 out of every 3 homicides is alcohol-related. It's also associated with sexual violence and violence against women. And drugs and illegal drug markets contribute to violence. I think in the exercise we did earlier on what health and safety got to do with it, we did talk about how alcohol can heighten aggression and make violence more likely. And I think neighborhoods that are most affected by violence, are also you commonly see a lot of liquor stores in those areas too. So it's about kind of what businesses open up in those areas and what's promoted and sold in those neighborhoods and how does that connect to violence. So what does this look like in Salinas? Why is this an issue that came to the top in terms of what the community said was important to them?
Yeah, I think it takes a minute or two for folks to get their answers in.
Okay. Jose Luis says, sorry, does not reside in Salinas. I'm wondering if Jose Luis resides in Monterey County or somewhere else. It's really sort of what does this look like on the ground? Even though this was a community level risk factor that was prioritized in Salinas, and I wonder if there are experiences or stories that from where you live that relate to this.
Yeah, and I think as we're going through them, people might not have, comments on all of them. I think what's important is, to have a little bit, a moment or two to reflect on this within the communities that, where folks are working hard to prevent violence. And sort of what does that mean? So maybe what we should do is move on to the next one. And, if there are ones as we're going through this that, you want to specifically comment on because they really are ones that came up as the highest priorities in the needs assessment, that would be great.
Okay. So access to firearms and other weapons is also another risk factor. Firearms can make domestic disputes lethal. So what would be just another argument or some kind of conflict, suddenly the introduction of firearms makes it a situation where someone could be seriously hurt or killed. The availability of guns and ammunition is associated with firearm-related deaths and injuries, which I'm sure is no surprise. And I wonder, what does this look like in Salinas? I remember a story I think Rachel told me where we were doing focus groups among youth, and a student was saying, you know, I have to transfer 2 buses to buy school supplies, but if you just want me to get a gun, I can just go down the street, no problem. And so, you know, it really speaks to the availability of weapons in U.S. cities today. Okay. Anybody else want to weigh in on the issue of weapons?
Or alcohol.
Or alcohol, we can keep riffing on that one too. There are a number of liquor stores in high-risk areas in my neighborhood, Jose Luis says, and at least for me, I try to bike to and from work, and I definitely take the long route because I try to avoid neighborhoods where there are lots of liquor stores. And I wonder also, you know, do other people react to those neighborhoods the same way as I am? Does that mean we're not getting to know our neighbors and not supporting local businesses? I think it has lots of economic implications also, not just social. Another risk factor that rose to the top in the Salinas prioritization process was poverty. Concentrating poverty and lots of other social problems in the same areas makes for the conditions that make violence more likely. I think you'll see residential segregation is closely tied to this too, because I don't think poverty alone is what makes people violent or not. I'm sure that's your experience too. It's really about when you have poverty and you have all these other risk factors and disadvantages, and all the people are all living in this one place that is really kind of forgotten by city government and not given a lot of resources, and those risk factors all kind of overwhelm the resilience factors in that community. When neighborhoods just don't have economic opportunities, I think it really changes the dynamic, and poverty becomes a major risk factor for violence, particularly in areas of concentrated disadvantage.
Yeah, and while you were talking about that, Benita, a number of folks are writing in about the problem of guns in Salinas and the availability and sort of the norms around them as well. So I want to just encourage people to continue, you know, to write that in, and now we can add, you know, thoughts about poverty as a risk factor for violence in Salinas.
All right. Interesting. Jose Luis talks about having a gun or having a toy gun is a rite of passage. So it really speaks to sort of how violence and peace as an issue and a concept is really intertwined with customs and culture and rituals and sort of how different communities construct meaning. And to think about, you know, is that really what the community wants for itself, and how did that develop, and how we might shape that in, you know, in partnership with the community.
Well, and one of the comments that just came out is about blight, blight affecting the community self-image, and I think that maybe gets to, you know, the next one we're going to talk about.
Community deterioration. I'm not sure, the broken windows theory is all about sort of when you see signs that the neighborhood is kind of falling apart and no one's caring for the spaces, that it just sort of becomes this kind of snowball effect where it just keeps getting worse and worse. So I think that speaks to the blight and kind of a reflection of whether the community is caring for itself, whether people care about what spaces look like. And here's just an example in Philadelphia of the images from where a community took on a greening project where they took vacant lots and turned them into green spaces. And it just speaks to how neighborhoods with litter, graffiti, abandoned cars for housing, all these things kind of are just signs that people aren't caring for this space, and it's associated with increased violence. So what does this look like in Salinas? I think Vin started that conversation with blight. What else does the text chat say? Jeffrey is talking about Salinas is seen as dangerous due to gang violence. Media is also something that can affect the reputation of neighborhoods and the perception of violence and whether people are afraid in certain parts of town. Again, whether there are guns and drugs versus jobs available and programs for youth and opportunities. And I think that that's a good segue into what Rachel's going to talk about in terms of resilience factors and protective factors. That it's not just risk factors, there's a whole other side of the coin, which is what I think Vince was getting at, where, you know, if you look at drugs and guns as risk factors, on the resilience side and protective side, there are economic opportunities and lots of other things that we can start promoting in Salinas.
Thanks, Anita. Yeah, and I think that it's really important to emphasize the notion of that it's not, you know, just about risk factors. Dr. James Garbarino, who's written about toxic environments, talks about, you know, that it's really no one risk factor by itself, but it's really the overwhelming accumulation of risk factors without the compensatory protective factors. And, you know, we know that these can be very powerful in terms of being protective for individuals and communities against violence. So let's look at community level protective factors. And what you can see on here is they're all in yellow. So that means that that these community level factors came up in the STRIVE assessment as important protective factors for Salinas against violence, and they include economic opportunity, the built environment and community design, social cohesion and connectedness, quality schools, and opportunities for meaningful participation. So let's go through those. Economic opportunity, you know, of course, we talked about poverty already, and one of the things that comes up around poverty is sort of the lack of opportunity and lack of alternatives. But in terms of economic opportunity at the neighborhood level, we know that neighborhoods with employment opportunities provide residents the means to earn a living wage, and that people with access to jobs, training, support, services, loans, and investment capital promotes participation in a mainstream economy. And so what some of this is actually getting at is the opportunity to make a living and participate in the economy without turning to criminal markets to do so. So let's see if folks have anything to say about economic opportunity in Salinas. What are some of the real strengths and assets that you have in Salinas to build on? And I know these aren't really easy questions, so I'm giving folks a little bit of time to be able to write something.
Yeah, I recently read an article out of Boston, which was just a study of how giving youth from low-income backgrounds summer jobs actually significantly lowered the likelihood that they would have fought with someone else physically in the last 30 days and a number of other indicators for violence. And so economic opportunity and I think youth employment and giving young people skills and jobs really does make a difference and helps make violence less likely.
All right, let's go on to the, Linda just wrote about the current effort to bring technology from Silicon Valley and merge that with agriculture, so new developments. Okay, built environment. So community design can enhance community networks, foster trust, and positive social interaction. So, you know, that really means places can be designed in a way that decreases isolation, helps people get to know each other, and really fosters some of those core protective factors like trust and positive social interactions. It can also be used to sort of increase foot traffic and visibility and perceptions of safety. So the notion of more eyes on the street and that, violence and crime doesn't happen when it's being watched, and that can happen through a number of different design features. So let's see if folks have thoughts about sort of what the built environment, elements of the built environment in Salinas. And I, at the same time we're doing that, do not want to discourage the conversation going on around economic opportunity and assets that's also going on. So feel free to keep that going.
Yeah, the photo on the last slide on the built environment is actually of a parklet in San Francisco. The Department of City Planning and Zoning is working with businesses who want to create those spaces for pedestrians, for shoppers, for people to kind of sit and read and chat with their neighbors. And that's just the photo on the last slide was just one example of the parklets that the city has been encouraging. It's one example of how the built environment, like Rachel was saying, can really increase those social connections and also promote business.
Okay, while people are thinking about the built environment, let's talk about quality schools. High-quality education that fosters positive social and emotional development in young people, protects against violence. We also know that there's, high correlations between high school graduation rates and lower rates of violence. So, having quality education, keeping kids in school, supporting young people to stay in school, which are things that can happen through community level interventions, is really critical. So let's just take some of your thoughts about schools in Salinas and what this looks like and what the opportunities there might be to build on this as a protective factor against violence.
It seems like there's been a lot of dialogue about infrastructure pieces, street lighting from Ariana, multi-use paths that connect community amenities and increase access, it sounds like. And then really investing in the places that could benefit the most from improved infrastructure. Ariana again talks about affordable school programs and childcare. I think that came up earlier in terms of linking it to the risk factor of poverty. So that's maybe another area of focus.
Okay, so any thoughts about schools or education as a protective factor? And while you're thinking about that, let's move on to the next one, which is strong social networks. So we previously talked about how the built environment and built environment design can support strong social networks. And that's really important because these kinds of connections are protective against violence. Robust social networks correspond with lower rates of homicide and less alcohol and drug abuse. And positive interactions with neighbors foster mutual trust and reciprocity, and that can help a community reinforce its own values. So creating opportunities that can foster social networks is important, and violence and the fear of violence is certainly one thing that can also be counter to strong social networks and trust. So they kind of go hand in hand, but I think paying specific attention to that and providing those opportunities is protective. And I know that there is a lot of community building work that's going on in Salinas. Like for example in East Salinas and the Alisal. So I'm curious what kinds of when you think about strong social networks in Salinas, what do you think about? What does it look like there?
For sure.
Okay, so so again, while you're thinking about what the strong social networks, are in terms of building on that to be protective against violence, I'm going to move us on to the next slide, and say, that basically now what we've talked about is a way to think about at a community level the need for prevention and population-based approaches, and that the way to do that is through reducing community-level risk factors and promoting community-level protective factors. And so this is just a sample list of the kinds of strategies that can be put in place at the community level that specifically address those risk and protective factors, or those kinds of risk and protective factors. I started out here with universal school-based violence prevention, and the reason I have that in as a community level strategy is because if you think of the school as a community, this is really about a school-wide level. It's not geared to individual students, but it's geared to the whole school and can improve school climate. And what we know from a CDC meta-analysis is that these kinds of strategies can reduce school violence by 15% in 6 months. Other community-level strategies include street outreach and violence interruption strategies, such as the Cure Violence model, which is an interruption model designed to really reduce shootings and killings, including retaliation murders. Youth leadership development and youth empowerment strategies, really building on young people as assets and providing more positive opportunities and roles for them. The notion of community building, and really building the capacity of the community. I think someone mentioned earlier on how important the community is in developing the solutions and the strategies and approaches, and really they know what their community needs. So that community building piece, such as is going on through Building Healthy Communities initiative, is really critical. Changes to alcohol policies, really addressing the alcohol density and availability. In South LA a number of years ago, the community coalition down there did a needs assessment in the community, and we're actually surprised in a way to find out that the availability of alcohol was the #1 concern in the community there. Though when they really thought about it, I think wasn't so surprising, because there were actually more liquor stores in South LA than in the entire state of Pennsylvania. So they really undertook a very big community organizing strategy to get the city council to really change their zoning and permitting laws. And within a couple years, they were able to either shut down or make sure that shut down or not reopened over 200 liquor stores within South LA. And they were also able to document 27% reductions in crime and violence within a 4-block radius of each of those liquor stores. So, that's a kind of community level strategy that we know can have an impact. Business improvement districts are really emerging as a model. We've seen the data showing 44% reductions in crime levels within business improvement districts, and micro enterprise and economic empowerment strategies are also key. And then finally, crime prevention through environmental design, which is really getting at the things we talked about in terms of, on the risk side, sort of the community deterioration side, and on the protective side, the built environment that can foster positive social networks and create more sort of eyes on the street, visibility, lighting, address blight, etc. So I talked a little bit already about the Cure Outreach and Violence Interruption strategy. The studies from Cure Violence have demonstrated 41 to 73% drops in shootings and killings and 100% drop in retaliation murders. The Baltimore Safe Streets program, which is sort of the first or the longest running replication model, has seen some really positive effects as well in neighborhoods where they've implemented it. I talked about this already, that universal school-based violence prevention can reduce violence by 15% in as little as 6 months. And then, you know, we talked about SEPTED, and we wanted to give you a brief example of one community we worked with that's been putting this in place.
So SEPTED stands for Crime Prevention Through Environmental Design, and I think Tara in the chat mentioned that it's already been adopted by the city zoning department for any new development, and that's a really promising sign and something to build on. So in West Chula Vista, they adopted SEPTED as a strategy, and the whole principle behind SEPTED is kind of when you increase visibility and when people think that, you know, if they break the law or do something suspect, that it'll be seen and reported and others will notice it, that it discourages that behavior. So in West Chula Vista, they really used SEPTED as kind of an entry point to engage young people and residents about what concerned them in general about where they lived. It wasn't just about SEPTED, it was really about an engagement process, and it was kind of like the first sort of an entry point into a larger conversation about these issues. So they decided to undergo a photo voice process, which is when they give residents and young people cameras to go around their neighborhood and take photos of things that worry them, that they want fixed, or things that they really like, that are assets. So again, it's that focus not just on risk factors, but also on resilience factors. And they came together and they looked at all the photos that they took. I think it was like hundreds of photos. And they identified different themes, and in discussion with different community leaders and young people and experts on issues of violence and healthy eating, and with other agencies and nonprofit organizations, they developed a bunch of recommendations around those themes on not just what are our grievances and what do we not like and what do we want fixed, but also how can the city help us do that. So one example of this is the utility boxes. This young person said the electrical boxes are filled with graffiti, and when you see graffiti, you can predict that gang violence is around there, and it's not safe at all. This is really common in some parts of Oakland as well, and I'm sure in some of the neighborhoods where you live and work. And the recommendations that this group developed around graffiti was to enforce a 24-hour graffiti removal ordinance, and also to enlist businesses and residents in painting the electrical boxes with community images and art. And this is one that after they presented to city leaders that they actually embraced and moved forward with. There was a utility box project in West Chula Vista. If you visit there, you'll see there are all these utility boxes that are covered in sort of really colorful paint, and they decided to focus on sort of these symbols that are very common in pre-Columbian art so that it would really resonate with residents. And since then, they've kept them graffiti-free, which is a really great sign. The other thing that's great about that utility box project is it involves the community. So young people actually were the ones who designed the boxes and painted them with their parents and their neighbors. And it really, I think, gave the neighborhood a sense of ownership over their place. Another example was liquor stores and how common they were in this area. This 13-year-old said that liquor stores encourage, negative behavior like drinking near tattoo parlors and barber shops in this particular strip mall. And not sure, I don't know what the numbers are in terms of people who drank outside the liquor store and then got tattoos they later regret, but it was something that this young person flagged as a concern for him and his friends. So some of the recommendations they developed was to create a moratorium on liquor stores on Broadway Street, and also creating design guidelines to discourage signs and advertisements that kind of looked like graffiti and made their neighborhood less attractive. So the young people met with the zoning department, and in interviews with youth, they said what was so amazing about this process wasn't so much the recommendations or the septet concept. It was really, that they were taught how to use their voices so that they could be heard, so that they could make a difference, and that they were seen as sort of valued advisors to city staff. Another example of a concern that was flagged was lots of hiding places. This is a photo of a Costco kind of big box store, and it's kind of behind the warehouse. There's like a parking lot and a bunch of undergrowth. And some of the recommendations they came for this was, to trim the bushes back so they're 2 feet or shorter to promote visibility, and then trimming trees so that they're 6 feet or higher to kind of create a sense of openness. And what I found so curious about this case study was that this is really the only recommendation in their report that directly related to septet. A lot of the other ones spoke about other community level risk factors or resilience factors, and this is the only one that actually ties back to septet, which was kind of the original idea for this project. These recommendations turned into guidelines for park construction that the Public Works Department adopted, and they started looking at, how do we apply this in parks to promote lighting and to promote a sense of openness. So you might be wondering, who does this take? I think that again and again in the Chula Vista process, residents said, we can't have a safe and vibrant community if people are living in fear. And at least in their process, in order to kind of see the changes take place, it really involved everybody. It involved the police department, of course, it involved public health, but it also involved public works and zoning and the transportation department, and just such a broad array of partners at the table. And I think that the answer to this question, you guys already know. I mean, it's the community coalition, right? It's CAST and all the partners that are gathered on this webinar and the ones who can make it stay too. So I think you guys are well equipped to start taking on the community level risk and resilience factors and to kind of level up since we've gone through the components of the public health approach to violence. As you're thinking about implementation for reducing risk factors and resilience factors, I hope you revisit the text chat that we have here to kind of feed your thinking and really think more like who should be involved, who on the coalition has expertise in this, how can others support those key partners, and how can you really sort of add another degree of nuance and sophistication to your violence prevention efforts as they are now. I know that Vince earlier had said a lot of people want to contribute to preventing violence. They just don't know what their role is. And Rachel and I have been working for many months on this really exciting project on all the different contributions and roles that different sectors in local government can play in preventing violence. It should be posted on our website in the next couple of months. And really what we've learned from that is the whole is greater than the sum of its parts. And to really see violence go down and young people thriving, it's really about coming together and getting to shared outcomes, looking at the strengths of the various partners, and implementing joint strategies. That's really the key to leveling up and focusing on primary prevention and at the population level.
So I think with that, what we want to do is open it up for discussion, questions and answers. What we're going to do is allow you to do that through the text chat, or we're also going to unmute the lines, and that if you have a question, you can raise your hand and we can call on you, so that will give you a chance to talk. And while you're either raising your hand or text chatting in your questions, one thing that I wanted to go back to is someone early on in the text chat said that some people get most of the blame for social issues, and I think that that's really true. I think that in the U.S. we really have this sort of notion of individual responsibility and pull yourself up from the bootstraps, but we also know that opportunity is really not distributed evenly or fairly. And one of the things that I've learned, and this includes through a number of years ago, I developed a community resilience assessment tool for the U.S. Office of Minority Health. And one of the things that community frame allowed was to put, one, the focus off of individuals and onto the community, but two, to really identify the really historical and ongoing institutional practices and policy changes that had contributed to the conditions in communities that were really putting the whole community at risk. And so by looking at sort of that community level, it provides an opportunity to get beyond the notion of blaming individuals, and that further analysis can also get beyond the notion of blaming communities, because, you know, really there has just been really a long history of these practices and policies that have resulted in really a lack of opportunity and hope in a number of places. So if anyone has a question or wants to talk on the phone line, please raise your hand and we can unmute the lines.
And feel free to elaborate on any of the contributions you've made to the text chat so far if you want to speak in more detail about that. This time is sort of open for discussion.
So what does that mean? Okay, so we have a question. Will the PowerPoint be made available? We can certainly make the PowerPoint available,
We can email all the participants after the webinar.
We'll do that. Oh, how difficult is it to begin SEPTED? So I think that's a good question. I would say that we, just full disclosure, are not the SEPTED experts. I know that that the STRIVE initiative has already prioritized SEPTED. That's my understanding, as one of the strategies they're going to be implementing, and it might be that maybe someone from the health department wants to talk about how you're going about implementing it. So starting with training, there are some groups who do really great training on SEPTED, and there are a number of very specific strategies. So it sounds like Salinas is going to start training, or STRIVE is going to start training in the fall, and that will be a way to get started.
Yeah, and Tara may know more. She's the one who chimed in earlier on how the zoning department is adopting it, so she might have more information or know of a contact who can provide details.
Yeah, and I also think what's interesting that you noted, Benita, about the Chula Vista example is that they talked about it as SEPTED, but in a way what that was a photo voice project for young people to have input into their community, and some of the pieces ended up being sort of in exact alignment with SEPTED, but others were not necessarily. So I think there's other ways to sort of implement some of the principles and overall objectives of SEPTED that might not fall exactly within sort of what the protocols of that official strategy is. So I'm gonna give folks another minute to text chat in or raise your hand, and I think if there aren't any questions beyond that, what we can do is end a few minutes early. Just don't want to cut folks off.
Yeah, I think that the text chat already has been pretty interesting to follow because now that we're talking about SEPTED, there have already been some locations identified by some of the participants as places you might want to start, some candidates for where you might want to implement SEPTED. Like Charlotte was talking about how in Chinatown there are structures and barriers and fences that are very isolating, and how SEPTED could open that space up. Ariana talked about eyes on the street. It sounds like there are already some good ideas to start looking at how it can be implemented in Salinas.
Yeah, and so Vince wrote that the challenge seems to make sure that individual components amount to an integrated whole that has collective impact. I think that's a really good point. And Pearl, if you could go back to the last slide. This this depiction is really, I think, about that collective impact and how you get to shared outcomes that build on the strengths each partner brings and what joint strategies can be. And is really the purpose of this tool we've created called Collaboration Multiplier. When through our National Unity Initiative, which we have been doing for 8 years through the Centers for Disease Control and Prevention, we did an assessment at the beginning, so about 8 years ago. And one of the things that came out of that through both a look at baseline violence rates, but also interviews with police chiefs, mayors, school superintendents, and public health directors in a third of the largest cities in the United States, was that cities that had the most coordination and collaboration across sectors also had the lowest rates of violence. So, I think that's a pretty powerful statement around the need for collective impact. There's all kinds of the leveraging the existing and way too minimal resources, not duplicating efforts, making sure that, the most important things aren't slipping through the cracks, et cetera. So I think that notion of collective impact is very important.
We'll definitely be sending out notifications when this tool is ready for use and for you guys to explore and see how you can apply it in Salinas. If you haven't joined our Unity e-alert list or Prevention Institute e-alert list, feel free to, when you fill out the evaluation, to request to be added so you can be notified.
And then the next question is from Rebecca about SEPTED trainings that can focus on building resilience, efficacy, cohesion, or empowerment. And this might be something, too, for Becca, for you and Linda to talk about offline, because I know she's already arranging this training and might have looked more into stuff. The folks I'm aware of who do this training is Carter & Carter Associates. And I worked with Sherry Carter on the development of the Community Star Index, which is really a sustainability rating system for cities and communities. And she and I were both on the safety goal. I know that early, like SEPTED 1 was mostly about physical design and infrastructure, and that SEPTED 2 has incorporated much more about how do you foster social networks and connection and interaction. And so I think even the evolution of SEPTED has been much more headed in the direction that you're talking about, which I think was really a very important development in sort of the evolution of SEPTED. Okay. It looks like not a lot of questions right now. We will definitely get the PowerPoint out to folks who are registered, and we want to ask all of you who participated to complete the evaluation, and we've just put up a link to it, which is the SurveyMonkey link that you just saw. So please fill it out. It helps us understand how to design these in a way that has the most value for you. And we really appreciate your participation through the text chat. It has its pros and cons. It's not quite the same as sitting around a table and talking popcorn style, but I think really sort of the depth of sort of the size interaction that started to go on was really had a lot of added value in terms of the content. So thank you everyone for participating, and I think without further ado we can say thanks and goodbye.